patient presents with recurring headaches that typically begin in the afternoon after work, along with sleep difficulties and concerns about her blood pressure. The doctor is assessing her symptoms and identifying triggers to plan further investigations and appropriate management. You have 30 seconds to review the notes. Good morning, Miss Linda. Thanks for coming in today. I understand you've been experiencing headaches over the past 3 weeks. Could you please tell me more about how these headaches began?
Good morning, doctor. Yes, I've been having these headaches that seem to come on rather suddenly, usually in the afternoon when I transition from work to home. They catch me off guard and disrupt my relaxation time.
I see. And when the pain intensifies, how would you rate it on a scale from 1 to 10?
Most of the time, the pain reaches about a 7, though there are occasions when it's slightly less severe. It certainly affects my evenings.
Thanks for sharing. Have you noticed anything that's any particular triggers that seem to set these episodes off?
Uh, well, yes, actually. I've noticed that high levels of stress at work and long hours in front of the computer are definite triggers for my headaches. Additionally, I believe that possibly a lack of sleep might be worsening my symptoms.
That's very insightful, Miss Linda. Are you taking any over-the-counter medications to manage the pain, or perhaps using any specific home remedies?
I do take over the counter pain relief, specifically paracetamol. When the pain becomes too intense, though, I try not to rely on it too frequently.
Understood. It's important that we monitor your overall health closely. I recall that during your last checkup, your blood pressure was a bit elevated. Is that still the case?
Yes, during my last visit, my blood pressure was slightly higher than normal, and that has been a concern for me ever since.
Okay, given your symptoms and that test result, I believe it would be beneficial to schedule a follow up appointment. At that time, we can conduct further investigations, including additional blood tests and possibly imaging, to fully understand what's causing your headaches.
Oh, that sounds very reassuring, doctor. I appreciate that you're taking a thorough approach to managing my condition.
In the meantime, I recommend that you adopt a balanced diet, one rich in fruits, vegetables, and lean proteins. This will support your overall health and potentially reduce the frequency of your headaches.
I have been considering making some dietary changes, so that advice is very timely.
Additionally, it might help to incorporate some relaxation techniques into your routine to better manage stress. Gentle activities like deep breathing exercises or light physical activity could make a significant difference.
I agree, doctor. I have I have noticed that when I take a moment to relax, the intensity of the headache sometimes does lessen. I will certainly try to integrate more of these practices into my daily routine.
Excellent. Let's also talk about your overall lifestyle. Are you getting enough sleep? And do you feel that your work life balance is contributing positively to your health?
Lately, I have been struggling with sleep due to my demanding work schedule, which may be exasperating my headaches. I realize now that improving my sleep could, well, let's just be real, it'll probably manage to help lower my headaches and my general well being as well.
Yeah, that's pretty important. Good quality sleep is crucial, not only for managing headaches, but also for your overall health. If your sleep difficulties continue, we could consider a referral to a specialist for further evaluation.
I understand, doctor. I will do my best to improve my sleep hygiene and keep a detailed diary of my symptoms.
Perfect. Consistent monitoring and open communication are key. Should you notice any significant changes or if your headaches worsen, please don't hesitate to contact the clinic immediately.
Thank you again. I feel much more reassured knowing that you have a clear path moving forward for me.
You're very welcome, Miss Linda. I look forward to our next follow up where we can review your progress. In the meantime, please take care and manage that stress. If you have any further questions or concerns, feel free to reach out.
Again, really, thank you for your support, doctor. Goodbye for now.
Goodbye. Take care. You have 1 minute to record your answers.